You're watching CTOM TV. Knowledge is power.
One of the monitoring tools that's really changed how we treat cancer is called the liquid biopsy. And this detects basically the level of a certain driving mutation in your cancer from the blood. So what we do is we take a sample of your blood and we'd look at the level of that mutation. So just a little primer, tumor cells release their DNA and RNA proteins into the blood and into various fluids in the body. And they do that as a way of metastasizing. They release them in these little packets called exosomes. And actually, in fact, it's even been shown that normal cells could take up these tumor-derived exosomes and start expressing these mutated genes or altering these mutated, using these altered genes and proteins and so on, and it can actually convert normal cells into tumor cells. So the way we do this is, since we know if we see your mutations that are being released by exons in the blood, and what we do is we look at the amount of that specific mutation that we know is only in your tumor cells. So let's say you are about to start treatment on some drug, you want to know if it's going to work. Then what we do is we'd take a sample of your blood, and let's say it's 8% before you start treatment. Then we'd take another sample a couple of weeks later, and if it's down to 2%, then we know it's working. If it's gone up, or if it stays at 8%, then we know that drug's not working anymore, and we need to try a different drug. The importance of this is we can use this to determine whether a treatment is working within 8 to 10 days after you start treatment. You don't have to wait 4 months and measure the tumors and see if they've grown or not. Importantly, this can be used to determine whether immune therapy is working or not.
Thank you for watching CTOM TV. Subscribe below and stay informed.